Guys, we're doing a two-person transfer today. We're going to go from wheelchair to floor. The first thing we're going to do is we're going to line up the patient where we're going to have them go from wheelchair to floor. So go ahead. Alright, next you're going to inform the patient that you're going to do a transfer from a wheelchair to floor, and you're going to lock the brakes. Perfect. You're going to remove any armrest or footrest that might get in the way of the transfer. So we're going to have one therapist in the front of the patient, and he's going to get into the squat position with proper body mechanics. Going to place his hands underneath the knees, interlacing his hands. The patient in the back is going to tell the patient to cross his arms. Perfect. You're going to the therapist is going to place his arms underneath the armpits. There you go. Perfect. And then both therapists are going to communicate doing a 3-second countdown to make sure that they're properly getting the patient safely up. Okay? 1, 2, 3. Perfect. Slowly lowering the patient down. Perfect. Once the patient is safe, one of the therapists is going to move the wheelchair away from the site. And that's it. Alright, hey guys, we're going to do a 2-person lift from the floor to the wheelchair. So the first thing we're going to do is we're going to have one of the therapists bring the wheelchair as close as possible. Alright, he's going to unlock the brakes. Perfect. He's going to place it close. And then he's going to hit the brakes again. And they're going to remove any equipment that might get in the way of the transfer. Perfect. So now the therapist in the back is going to position the patient from a supine to long sit, but he's going to instruct her what's going to happen before he does anything.
Listen, are you able to push yourself up? We're going to go into a sitting up position, okay?
Okay.
Can you use your arms and push yourself up?
Yep.
Perfect.
Good.
So this would be an example of a paraplegic. A quadriplegic obviously would not be able to do this. So the therapist in the front is going to place his hand under the patient's knees. He's going to interlace his hands. Perfect. The therapist in the back is now going to instruct the patient to cross their arms.
Cross your arms, please.
Perfect. He's going to place his hands underneath the armpit. And the therapists are going to communicate to do a 3-second countdown to lift the patient.
Okay. 1, 2, 3.
As you can tell, they're using proper body mechanics, and they're taking the patient into the wheelchair, and they're going to slowly bring the patient down.
You guys have to push me back.
Alright, and then they're going to place all the proper equipment needed, the leg rest and the arm rest. Perfect.
Three, two, one.
Today, we will be demonstrating how to do a transfer from the wheelchair to the floor on a CVA patient. And in this case, we're going to assume the patient's weak side is the right. A few things to consider before doing the transfer is to make sure that the wheelchair is locked. Make sure that you put a gait belt on the patient. You also want to make sure that you stand on the weak side, in this case, the right side. So the first thing we're going to do is ask the patient to scoot forward in the chair on his strong side and push out the affected leg with his strong leg.
Scoot forward.
The patient will then roll onto his tummy and scoot down to the floor.
Nice.
The patient will then bring the hand down and lower himself to the floor.
Put this foot under. Straighten out your legs. Support you from the back.
The therapist will use good body mechanics, keeping a straight spine while assisting him to the floor.
So here we're going to go ahead and demonstrate a floor to wheelchair transfer for a post-CVA patient. Okay, so what we're going to do here is that the patient's non-affected foot, in this case his left foot, is going to go ahead and hook on over to his affected side, so under his right foot. Good. Therapist will be on the back supporting the patient. Now the patient here is going to go ahead and roll on over to his non-affected hip, in this case being his left. He's going to use that left arm and he's going to go ahead and hook it on top of the wheelchair. Good. Now you continue to roll onto your left hip. Good. He's beginning to bend his knees here. Therapist is supporting him. Good. Now if the patient is strong enough to do this, he can use that non-affected arm to help push himself up. You want to go ahead and hook your foot under your right. Good. All right, and that demonstrates a floor to wheelchair transfer for a post-CVA patient.
In this segment, we will demonstrate how to navigate up and down a curb in a wheelchair with assistance. First, the therapist will instruct the patient to keep their hands in their lap. The therapist will then turn the chair around and bring the wheels fairly close to the edge. The therapist will then explain to the patient that they will be rolling the wheels down the curb. Once doing so, the therapist will lean in close with their hip on the back of the chair and slowly maneuver the chair with the use of their leg under the seat with body weight. Next, the therapist will inform the patient that they will tip the chair slightly backwards into a reverse wheelbarrow, using the rear pegs to bring the front wheels down in order to avoid the leg rest from hitting the curb. And that is demonstrating how to maneuver a wheelchair down curbs. Now we will reverse this motion on how to maneuver the chair back up a curb. Up the curb, first the therapist will instruct the patient to keep their hands in their lap once again. Therapist will raise the front wheels by tipping the chair using the rear pegs. Then they will bring the back wheels to the curb. It is important to note that the rear wheels should make contact on the curb before placing the front wheels down. Next, the therapist will use their body weight to assist pushing the chair up the curb using the surface of their hip, while performing all this with proper body mechanics. And that concludes maneuvering a wheelchair up and down the curb with assistance.